So my wife and I had our son about 3 years ago, and not only did we pay a very high deductible on the front end, but we continued to get bills thereafter. Upwards almost a year after he was born, we received a bill for $1,000. I remember calling the hospital, asking them to give me an itemized bill, how much I'd paid, how much I still owe, so I could pay the remainder. The hospital didn't know. It didn't know. So you're telling me and telling our audience that with Fair Market Health, there are no hidden costs afterward.
No.
You pay up front, and that's it.
Exactly. In fact, there's a chance that you're actually going to get some money back. So,
Really?
Yeah, let's go back to using the gallbladder as an example. Sometimes when the surgeon takes the gallbladder out, if there's something that doesn't look quite right, they want to send it to a pathologist. So that's yet another medical professional who's going to look at that gallbladder under a microscope. So that's an additional cost that's incurred. Well, we've wrapped that into the price. And so if you have your gallbladder taken out and your surgeon decides not to send it to a pathologist, you'll actually be getting money back on the back end. So we really want to make this as simple as possible. We don't want there to be any surprises. And I think the important thing is this isn't just for the individual. This is for the business owner. You know, I'm a small business owner. I run a small family practice here, and I take care of my employees. And so I would love to have a system where I'm not paying the very high price of insurance to then pay the very high price of medical procedures. If I could even help pay for those procedures out of my own business expenses, in the end, it's going to help me as a business owner. Because when I send my employee through the system, let's say they need their gallbladder taken out, and that goes through the insurance company, I get what's called insurance experience. And experience is just a fancy word for we get to raise your rates next year. So the more experience that a business incurs during the year, their rates are going to rise the next year. So they're ultimately going to pay for that in the long run. And in many times they're paying thousands and thousands of dollars more than they should for those procedures.
Yeah. So who really benefits from this plan? You kind of talked about individuals and business owners that maybe are self-insured, but then also those who provide Cadillac plans, so they're not hit with more of the insurance experience, as you called it later on.
Absolutely. Well, what's great about this plan is it really benefits everybody involved. You know, surgery centers, when you typically have again, going back to the gallbladder, when you have your gallbladder taken out, here are the people that are involved. So you're going to pay your surgeon to do the procedure. You're going to want anesthesia. Nobody wants to be awake during their gallbladder.
Yeah.
So you're going to also have to pay the surgery center. So this is typically an outpatient facility. It might be in a hospital. And so there's going to be nurses, and there's going to be a lot of people involved in your care. So each one of those components in the traditional system is going to send a bill to your insurance company. And sometimes they play a little game where they don't want to be the first one to send a bill, especially if they know you haven't met your deductible.
Okay.
So they're going to kind of wait a little bit. And that's probably why you got that last bill 6 to 9 months later.
They hadn't negotiated the price yet.
They hadn't negotiated the price, and maybe they're waiting to see if the deductible had been met. So there's a lot that goes in on the back end. And with Fair Market Health, who we're benefiting, number one, we're benefiting the patient, okay? Because you're going to be able to call and find out exactly what the price is going to be. There's going to be no surprises. We're also benefiting the surgeon. So, you know, back when I participated in insurance, I would perform a procedure. I would send the billing and the surgery note or the operation note into the insurance company, and then they would decide how much of it they were going to pay or not pay, or they might deny it altogether and say that they needed more information, or maybe I wrote the wrong code down, or maybe the codes have changed and they needed a modifier. There's all sorts of reasons why they would deny it, and actually the longer they deny it, the more money the insurance company makes.
A very cumbersome process.
Terribly cumbersome process, and actually adds 30 to 35% increase on top of everything.
Wow.
Just the process of paying. So it was a headache to be able to get money from the insurance company. And that same thing happens with the surgery center. So in this model, there's one fee to be paid. Once the procedure's done, the surgeon, the surgery center, and the anesthesiologist are all paid.
So you're talking the price that I see on the Fair Market Health website is the bundled price that includes the doctor, the anesthesiologist, the hospital fee,
and
I pay
pathology.
And pathology. And I pay this one time. And then I don't expect to see any more bills after that, and could indeed actually get money in return if we don't utilize some services.
Exactly. And then if you want to take that bill and then turn it into your insurance company, maybe you want it to be applied toward your deductible, maybe it was costly enough that you actually want to apply your benefit to that. You can, but it's going to be at a much lower cost than if you had gone through insurance in the first place.